I mean, it's interesting because, and it's also interested the co-investigators in Creole, collaborating with MI. The research now is that we want to look out for the best antihypertensive combination, two-drug combination, in blacks residing in sub-Saharan Africa. Because in spite of the burden, in spite of the fact that hypertension is the commonest cause of heart failure, a great cause of kidney disease, great cause of stroke in our environment, we don't still know the best treatment.
And in Aim High, what we're trying to do is to try to predict which drug will suit people, not just at a population level, so not just which drug will be best in a given population, say in Africa, but for an individual. And so that may help us to choose the drugs not only depending upon the country that somebody's from, but at an individual level.
The best way actually is to individualize therapy, make it as individualized, and I think that is the aim of the MI. Yeah, so looking at metabolomics, looking at genetic profiling, how can we individualize, most especially at the population level at this time. Remember that in sub-Saharan Africa, resources are scarce, or even when they are, we have a lot, they are mismanaged, and healthcare is not priority to many governments. So anything that could reduce the costs of management of risk factors like hypertension will go a long way.
The people in North America who are African respond slightly differently to the common drugs used for hypertension, and so in Africa itself that also seems to be the case, although there are far fewer trials of different types of drugs that have been done in Africa compared to North America and the UK.
So we have a lot to gain from the UK. I mean, the UK has been involved over the years. There's a lot of money that is given into research, cardiovascular research, and so on and so forth. They have the expertise. There's not much on cardiovascular research in sub-Saharan Africa. So I think in trying kickstarting this, or in trying to make sure that we have a lot of them, we need a lot of collaboration with UK institutions, of course, to do this.
And the collaboration between the Aim High and Creole will be very complementary, because it will give us this comparison between the genetic influence and the environmental influence. Well, it's already started, so we've made some plans to collect the data in the same way so that we can make direct comparisons, and that's already underway. And then we're looking forward to doing more detailed comparisons, which will be contingent upon getting some further funding, but the main comparisons we'll be able to undertake.